Welcome everyone to the BC Children's Kelty Mental Health Resource Center's webinar, Language Matters, introducing a new resource for families on mental health and substance use. Today we'll be talking about the new Language Matters resource that was developed in partnership with the BC Ministry of Education and Childcare. My name is Mario Del Casal, and I am a health promotion specialist with the Health Promotion and Health Literacy Department at BC Children's Hospital. I would like to start by respectfully acknowledging that BC Children's Hospital and the Kelty Mental Health Resource Center are located on the territories of the Musqueam, Squamish, and Tsleil-Waututh Nations, and we are very grateful to be doing our work on this land. The Health Promotion and Health Literacy Department at BC Children's Hospital works to enhance the mental health and well-being of BC's children, youth, and families. Our teams offer a variety of free services, supports, and resources specifically for school communities, including support with school mental health promotion, planning, and implementation, resources and support for parents and caregivers through the BC Children's Kelty Mental Health Resource Center, and support for school counselors and other clinicians providing mental health and substance use care through the Compass Mental Health Program. Specifically, this webinar and the Language Matters resource have been developed by our school health promotion team, and that we work collaboratively to support schools in promoting the mental health and well-being of their students by providing coaching, resources, and professional learning opportunities. A bit of housekeeping information before we begin. Please note that you are automatically muted and cameras are turned off. If you have technical questions or comments, please use the chat function. We have a wonderful team working behind the scenes to help make this webinar possible. So thank you to my colleagues, Alex, Amy, Bryn, and Michelle for working so diligently in the background. At the end of the webinar, a survey will pop up that we encourage you to please complete to continue to improve our webinars. And finally, the webinar is being recorded, and this will be made available on the school professional section of the Kelty Center website. So today I'm going to be providing an introduction and overview of the Language Matters project and resource. We'll then do a bit of the walkthrough of the resource itself and talk about some of the key ideas that are coming out of the resource. And after, we'll be joined by our exciting lineup of panelists for a discussion on the guide, and we'll have time for a few questions. So if you do have any questions about the guide for our panelists, please again use the Q&A button to ask them. To begin, I'm really delighted to welcome Crystal Dash. Crystal is the Director of Mental Health and Substance Use at the Ministry of Education and Childcare to start us off. So thank you so much for joining us this afternoon, Crystal.
Thanks, Mari. Hi, everyone, and thank you for the warm introduction, Mari. My name is Crystal Dash. I'm the Director responsible for mental health and substance use at the Ministry of Education and Childcare, and I'm grateful to be calling in today from the traditional territories of Lekwungen-speaking people. So we all know that mental health is a vital part of a child's overall development. It influences how they feel, think, and behave each day. At home, in the classroom, and in their communities. Just as we prioritize physical health, we must also prioritize mental well-being with the same care, consistency, and attention. The Ministry of Education and Childcare's mental health in school strategy was a significant step forward in BC. As the first of its kind in this province, it has signaled the importance of supporting student mental health in a coordinated, strategic, and intentional way. Ensuring that schools are equipped to foster safe, caring, and inclusive environments where students can thrive. In the strategy, we have 13 key actions, including the one that brings us all together today, which is to develop a common language and understanding of mental health terms to improve mental health literacy and reduce stigma. So why is this important? We know that when educators, families, and students use consistent language to talk about mental health, it promotes clear communication and a shared understanding. It helps reduce confusion and misinterpretations and ensures that we're all on the same page. Having a shared vocabulary also empowers individuals to recognize when they may need support. It helps normalize conversations about mental health, making it easier to talk about it and address concerns early. It also supports a proactive and preventative approach, helping us care for our mental health and well-being in everyday life. Using respectful, accurate, and inclusive language helps challenge stereotypes and misconceptions. It reduces stigma and fosters empathy and understanding. In support of this key action, the ministry has partnered with BC Children's Hospital over the past 2 years to develop two resources. Language Matters, an introductory guide for understanding mental health and substance use, a resource for educators and school communities, was released last year in April. And I have the pleasure today to speak a little bit about Language Matters, Understanding Mental Health and Substance Use, a resource for families and school communities, which we released in May with BC Children's Hospital, and which will be the focus of the webinar today. These resources were designed to support a shared vocabulary that strengthens partnerships between schools, families, and community partners. This alignment is critical. When students hear consistent supportive messaging about mental health from both schools and at home, it reinforces positive attitudes and helps them feel safe, valued, and understood. It contributes to a culture of care and belonging, essential foundations to learning, growth, and development. So I'm excited today that we get to share our new family resource. Before I pass it on to Mari, I just want to acknowledge the BC Children's Hospital team for their work in developing this resource. It's been such a pleasure to work alongside them. And Amanda Barnes on my team, she is a senior policy analyst who really led this work. So I will pass it on now to Mari, who will provide a brief overview and include how this resource was developed and the key concepts covered in it. Thank you so much for joining us today.
Thank you so much, Crystal, for that wonderful opening. We're so delighted to be collaborating with the ministry on this important work. To help me introduce the resource today, I'm grateful to also be able to have Dr. Angela Lowe join us. Dr. Angela Lowe is an adjunct professor at the University of British Columbia and also a researcher at Simon Fraser University. As a parent and an educator, Angela works closely with our schools and our Kelty Mental Health Resource Center team to develop content and resources for families and school professionals. So, Angela, we're so grateful to have you today and to help me talk more about the resource that we collaborated very closely together on. So, Language Matters, Understanding Mental Health and Substance Use, a resource for families and for school communities. Um, as an overview, it is meant to be a basic introduction to the concepts and terminology related to mental health and substance use. Everyone may talk about or describe mental health in different ways, and it can be based on people's own experiences or how their culture or community understands or talks about mental health. Talking about mental health may feel easy or natural to some, and for others, they may feel nervous, embarrassed, or even fearful to talk about it. So, as a companion guide to the Language Matters resource for educators and school communities that Crystal mentioned earlier, it's seen here on the right, it can help build a common baseline understanding of mental health and well-being, helping folks to be on the same page. This resource was developed in collaboration with an advisory committee made up of partners from education, mental and public health, and government. We also engaged parents at various stages of the project. In terms of our key audience, the key audience are, unsurprisingly, parents, caregivers, and guardians of K-12 BC students. School professionals and others working with families can also consult this guide, but please note there is the educator resource that you can look at more in detail as well.
Yeah, thank you, Mari. And so when I joined the team, we really wanted to be very thoughtful about creating a resource that comes alongside that educator resource that would feel relevant and useful to parents. And so to start us sort of thinking about what it would look like, we had questions for ourselves like what would parents want to know as they walk alongside their children through the ups and downs of school life? What might some questions be that the parents might and caregivers might have around mental health? But also, what might be some practical pieces of information that might empower parents and caregivers to take action should mental health concerns come up at school and at home? So, drawing from that, we developed a resource that provides answers to these questions that we hope that parents will find useful. That's something that they would reach for, and then they could come back again and again for answers.
Thank you, Angela. As you've heard throughout, the main aim of this resource is to help families learn more about common language and concepts on mental health and substance use. And we've done so by breaking it up into 3 sections, which I'll highlight when we do our walkthrough, and you can see them here on the slide right now. In developing the guide, we worked really hard to strike a balance between breadth, depth, and brevity. So while overall it does take 15 to 20 minutes to read, the guide covers a lot of ground, as you can see here. So while we share information on all of these topics, we do offer and link to other resources that have further in-depth information on those topics as well. So I will switch over to the PDF. So the first major section being defining and understanding mental health and substance use. So we ask, what is mental health? Here we view mental health differently depending on our culture, experiences. Again, some of us may have different words to describe mental health or mental illness, but the definition that we've gone here and is important to emphasize is that mental health can be defined as a state of well-being where we can live and work with purpose, have healthy relationships, and handle life's everyday stresses. Um, Here, we want to acknowledge and share that Indigenous perspectives take a holistic approach to wellness. So, here we describe that well being is interconnected between mental, emotional, physical, and spiritual health. And it's also connected to certain values or relationships with people and with the land, and the broader society, culture, and environment that we're embedded in. We then transition to talking about substance use. We emphasize that just because a youth is using substances, it doesn't mean that they'll go on to develop a substance use disorder. We also talk about substance use being on a spectrum, which goes from non use and beneficial use. So, beneficial use might look like taking medication as prescribed, to going down the spectrum to substance use disorder. And then we also ask why it's important to know about mental health and substance use. So there's a long list here that kind of continues onto the next page. The more we know about mental health and substance use, the more we can do to build well-being, and prevent and address mental illness, create safe and supportive environments both in the home and within the school community, and can also help strengthen relationships in those places as well. So the key points here in this list are really to improve well-being by supporting protective factors, which you can see in this chart here, understand and prevent harm from substance use, recognize issues early and to seek help, and to reduce stigma. We also talk about differentiating what mental illness is, as it's a term that can often overlap with mental health and can sometimes be mistakenly used interchangeably. Mental illness is when someone has a mental disorder that affects what they do, think, and feel. On the next page, we describe and provide some common examples of mental disorders that affect children and youth, and we've categorized them here. We then go on to talking about self-injury and suicide, which are challenging topics to talk about, but we feel very important, that we should describe them here as well. So we have some links here that I didn't point out in previous slides, but if there is more information that you would like to take a look at, you can always click on the hyperlinks that are available throughout the guide. We also then talk about describing the factors that influence our mental health, which involve complex interactions between our brains and the environment around us. So that includes our social connections, our experiences in childhood, and the things that affect our livelihoods. Can look like things like housing, food security, and employment. To end this first section, we wanted to emphasize why creating supportive, safe, and inclusive environments matter. Things like racism, discrimination, and poverty can impact mental health and mental illness, and can make it harder for people to get the help that they need. So, but families are not alone in supporting their child, youth, and mental health, and that really brings us into our next section, which is the home and the school working together for mental health and well-being. So overall in this section, we describe the role that the school community has in supporting student mental health. So we describe that school staff and educators have a role to play in building safe and inclusive spaces, help students understand mental health and how to maintain their well-being, teach about mental disorders and substance use to reduce stigma, and they can also play an active role in noticing changes in students' behavior and help identify supports if needed. On the other side of this page, we describe what mental health promotion is, and really what mental health promotion is to build up the protective factors that support mental health. Earlier, Crystal described the mental health in school strategy, so we talk a little bit more about it here as well. So schools follow the mental health in school strategy, which embeds mental health promotion in the education system. So that includes things in culture, leadership, curriculum, and the learning environment. And we point to three things in particular. So social emotional learning, which involves managing emotions and showing empathy for others, and building supportive relationships with peers and with adults. Mental health literacy, very much in line with the same premise as the first section of the guide, which is really to understand the different states of mental health, mental disorders, and where to get help. And the last area that's highlighted here is trauma-informed practice. So trauma-informed practice involves recognizing the effects of trauma rather on students' behavior and learning. To know trauma-informed practice means also needing to know what trauma is. And so we've described trauma here as a deep emotional wound that can lead to mental health and physical health problems, including substance use harms. We also then go to describing the general pathway that families can go through to get support in the school system. So this um, overall looks like talking with a trusted staff, which can be a teacher, a principal, or a school counselor. We talk a little bit more about what happens if more support is needed. So this can look like referrals to services outside of the school. We also talk about an individualized education plan, which can be developed if supports are needed within school. On the other side, we talk about the different professionals one could see for mental health support. So we describe who can diagnose, who can offer helpful services, supports, and programs, and others in the community who you can go to seek support for your own mental well-being. I'll now pass it off to Angela to talk about the last section.
Yeah, thank you, Mari. So we felt that this guide wouldn't be complete without also providing some information and practical suggestions around what parents and caregivers can do in their homes as well. And this is a section that would be new to the family resource guide in comparison to the educator guide. So just recognizing that parents and caregivers can play a big role in supporting children's mental health and well-being. And here are just 4 starting points. Really, there's a lot of resources that are out there, and you will see on the pages that there are some links out to different resources. But there are some sort of information and suggestions here that are offered that are very much based on the science of resilience. So expressing your love, focusing on strengths, creating a safe space for emotions, and then building coping and problem-solving skills. Can we get to the next slide, please, Mari? And yeah, then the other piece is that we thought it would be helpful to offer some ideas about how one might have conversations around mental health, with the sort of idea that it would be really helpful to start normalizing conversations on mental health so that our children can feel safe when things come up for them. And here again are some suggestions that we have. And then on the bottom right, some other links that could be helpful as well to find out more. And then finally, and I felt personally that this is maybe a really key message is to also say a reminder to not forget our own mental health. Just wanting to acknowledge that raising a child is really hard work. And sometimes as parents, we could be so focused on them or worried about them that we forget to look after ourselves. And wanting to end this section with a reminder that your own well-being matters too. And looking after ourselves is definitely a very big and important part of looking after our children's well-being. And again, there is some links there, and I highly recommend the one from Kelty Mental Health Resource Center. Thank you, Mari.
Thank you, Angela. So to recap, this resource covers a lot of information that is packaged in a way that is easy to read. While it is intended to be an introduction, again, there are numerous links to additional resources for further information on specific topics. And we hope that this resource will help people feel more comfortable and open to talking about mental health and substance use in a way that is respectful and inclusive. As families and school professionals, when we are able to speak a common language around mental health and substance use, we can really work together to create positive and supportive environments where children and families can thrive. So we'll now move into our panel discussion. After our panel discussion, we'll also have some time to take questions that were submitted into our Q&A. You do still have time, so please feel free to input questions into the Q&A. So our first panelist this afternoon is Kendra Mann. Kendra is the president of the BC Confederation of Parent Advisory Councils. Kendra has been actively involved at the Parent Advisory Council, the District Parent Advisory Council, and BC CPAC level for 15 years and has been part of the Kootenay Lake, so SD 8, and now Kootenay Columbia or SD 20 advocacy project. She has one daughter who graduated in 2019 and has two other daughters in grade 11 and 12. So thank you so much for joining us, Kendra.
Thank you for having me.
I would then like to introduce William Nichols Allison. So Will is a school counselor in Greater Victoria SD 61. He's the Vice President of Advocacy for the BC School Counselors Association and former publications chair and editor of BC Counselor magazine. Since 2022, he's advocated for mental health for every child, the principle that every child should have access to the care they need when they need it at no cost. And the current advocacy for the BC School Counselors Association is focused on improving student access by ensuring more counseling time in schools. So thank you so much, Will, for joining us today. And finally, I would also like to introduce Colvire Mann. Colvire is a school trustee for the North Vancouver School District. She's been a resident of the North Shore for over 20 years and is a parent of two children. She's held various roles over the years in her school parent advisory council and then in the North Vancouver District Parent Advisory Council. She's dedicated and committed to the success of all students and believe all students should have a sense of place and belonging regardless of their ability, ethnicity, or gender, including access to inclusive and safe learning environments. So thank you so much, Kendra, Will, and Colvire for joining us this morning.
Thanks for having us.
So the first question that I would like to ask you all, so what did you like about the guide? So I'll start off with you, Will.
Yeah, thanks, Mari. I really like the last section called Home and School Working Together for Mental Health and Wellbeing, because it speaks so directly to what I see and do every single day as a school counselor. When we're trying to help kids who are struggling, the most effective thing we can do is have a good alliance between family and the school, be on the same page. And especially like pages 11 through 18, we saw some of them just have so much practical information for families about how schools are already supporting students' mental health, who you can talk to, what to do if you have questions or concerns, and also how to take care of yourself, because that's a really important part of taking care of your kids is modeling those healthy coping behaviors. And then just overall, as I read through the guide, I just was really encouraged to see how strengths focused it was and very attachment informed. So what I mean by that is that it really stresses the power of caring relationships. We all know that our kids do best when they have lots of trusted adults in their life who encourage them, who comfort them when things get tough, and that they feel like they can venture out into the world and go and discover themselves. And I think that the guide does a really good job of just showing what a big difference all of us can make in kids' lives just by being a supportive person for them.
Thank you so much, Will. Colvire, I'll go to you next.
Okay, thank you. I echo what Will has shared. A lot of the homeschool partnership, I thought that was very well done. I think that the guide is really easy to read and understand. There's not like a lot of big words or, you want it to be simple so that you can easily go through it and pick which section, applies to you at that time. I also like the different sections that how it's put together. There's 3 defined categories. I think there's lots of really great resources and information available for families, depending on how, which avenue they need to reach out and to get the support. mental health affects people differently. Each family sometimes, it's not just your child. It also goes on to siblings or the rest of the family. And then having that support at the school level is very important. And as Will said, it's really important for the adults to have a safe adult that trusts, so that you are able to have the conversations and seek the help that you need. But mostly, I think building relationships and having that partnership, giving the school a role to play in supporting the family as a whole. I think it's really good, very valuable.
Thanks, Kavir. Kendra, what did you like about the guide?
I would mirror what Kavir and Will have said regarding the pages 11 to 18. However, I really liked pages 6 to 10. What I hear most from parents who have had children who are self-harming is that they feel alone and they feel like they can't talk about it. And so I love that it's addressed that that it happened, like there are children who feel this way, and give them some steps of where to go and how to help their children through that portion, and some clear and concise how to do this, and you can do this and you're not alone framework, which I thought was amazing. I also love the school working together, of course, with families, but making sure that parents who receive this know that they're not alone, I think is a great benefit.
Thank you, Kendra. My next question is, what do you think families will appreciate most about the guide? So, Kendra, do you want to respond to that?
I think they'll appreciate the concise of where to go. Provincially, all the supports that are there. Hopefully, they won't feel alone when they're struggling with something. Sometimes when we receive this information, it isn't relevant at that moment, but having it written down and being able to refer to it later, and know that there are places to go. I think that they will really appreciate that portion, and also the portion about taking care of yourself, care, I think is going to be a highlight of many parents.
Kavir, what about for you?
Sure. I think for me, the main thing for parents is to understand that your child's mental health can be affected in a wide range of ways. And I like how you have that all listed there. I think also where to get the extra support and help is key, because when you're in the situation, you don't know where to go first, like what is the first step. And I really liked before, like that one section in the guide where it says how to help your child, and then how to start the conversation, because that is key. If you can't talk to your child to figure out what's wrong, then you don't know how to help them or seek the help that you need to support them. So I think that starting that connection and conversation with your child, that's where it all starts in the beginning. And I think the guide is also not very long. It's not comprehensive. So it's like, just the right size. So people can like refer to it quite frequently and not get bogged down with all of the extra information. So if you know like which section that you need the support in, then you can elaborate and click on the resources and get the extra information, and then also access the website for more information that you need. But then also working with the schools, they also have a bunch of resources, and speaking to the counselor or your teacher, that also those resources then you can also seek out as well. But I think it's a really great resource for families, and really appreciative of everybody working on this to put it together.
So much, Kavir. And Will,
Yeah, well, I really appreciate what Culver said about how do we start the conversation, and speaking to that isolation that Kendra mentioned. I think another thing, an issue that we have in the world of mental health is the language itself. It's so daunting. I like to say that we have too many TLAs, 3-letter acronyms.
Yes.
There's a lot of this jargon out there. And it can be overwhelming for parents and grandparents who sometimes don't know where to start and don't know how to broach that conversation with the system itself, not just with their kids. So I think families will really appreciate the clear everyday language, giving accurate names, and so that people can actually feel confident having those conversations, to be able to go, for instance, into an IEP meeting, knowing I know what I'm talking about and I know how to advocate for my child.
Yeah.
And in my experience, people value practical ideas far more than abstract theories. And I liked that the guide doesn't spend a lot of time in abstract theories. An example is on pages 6 through 7, as Kendra already mentioned. I was really impressed that like 50 years of research in child development managed to be summarized in like 2 pages, basically. So a little bit nerdy of me there, but I really I like this research, and they did a good job of describing really key things that you can do with your kids, like getting good sleep, having positive friendships, having supportive adults in their life, having a connection to culture and to nature, healthy and safe use of technology. These are all things that you can go home and you can do something about right away. And that's a hopeful message. And that's another thing that's difficult when you're a parent and you have a child who's struggling, is that sometimes it can feel like there is no hope. But there's always hope, and there's lots of things that you can do. And I think the guide does a really good job of making it clear. As you said, it's concise too. It's less than 20 pages.
Thanks, Will. Kendra and Kavir, as parents yourselves, what parts of it did you find most interesting or relevant to you and your own family? I'll start with you, Kendra.
For myself, page 13, where it talks about trauma-informed practice. Like I've done a lot of education and stuff to understand trauma-informed. I am raising a child through that has had trauma in her life before she came to live with us, and knowing that there are probably many children out there that have gone through trauma and that it's not necessarily understood by all parents who may not be. I think that is going to be super interesting for my family to read up on, as well as other parents who might be helping to raise a child who's experienced trauma.
Kendra.
I agree with what Kendra said. Trauma comes in a lot of different forms, and understanding that, and actually, accepting that you are you need help, and that you are going through something that you do need professional support with. I like the listing of the factors that it comes, individual, social, and societal, like, the categories of how you have listed that out. I thought that was very well done. Teachers can use this resource as well, like students, if they feel comfortable and reach out to staff at schools, if they have this also as a resource, they can, start the conversation and see how they can support. And maybe it's not going to be at the school, maybe it's going to be something in the community that they can access, but also bringing the parent in, having that conversation. And then, having a group discussion, maybe with the staff, the student, and the family. I think, that could be very powerful. And also, I know we've all touched on this, is just taking the stigma that's attached to mental health and seeking help. We're still, it's 2025 and we're still talking about this. So I think, putting it out there that it's not a bad thing to seek help. You're just, helping, you're seeking the help that is going to help you move past this and become stronger as an individual. I also like the Indigenous lens that was shared, and how that can play a role in the resources that we have shared out. I just think it's just the right size, the right amount of resources. It's not overwhelming, and I just hope you get kudos for the work that was put in to put this together.
So much, Kendra and Kavir. My last question for the panel is, how do you see schools, parent advisory councils, and their families using this information? So, Will, I'll start off with you.
Yeah, thanks. I think it's important to acknowledge that every community in BC has different needs. So there's not going to be a one-size-fits-all approach, but nice thing about the resources that it can be used in so many different ways. And some communities might see this as a central tool that is the conversation starter and gets us moving in the right direction. And other places might use it more as a supplement. Personally, in my school community, we've been using the educator guide as a way to broach the topics of mental health frequently. And we just read through a couple of pages each staff meeting. And I've had lots of staff members come and be interested in particular things and want to learn more, and you can point them in the right direction. And I see that this guide has the power to be something like that too. So I plan on having some copies available for Meet the Teacher Night. And if somebody takes an interest, then of course I'm happy to talk to them about mental health and broach those conversations. I think as somebody who grew up in a small rural community where we didn't have school counselors when and where I grew up, that didn't exist. And we didn't really have conversations about mental health at all. The stigma of silence was the main stigma. So one of the powers of this guide is that I see it actually as being particularly useful in those contexts, because there still are places in BC where it's very hard to get access to mental health. And I'm hopeful that the people who live in those areas may be able to start having these courageous conversations and maybe use some of the information to advocate for their kids. And just doing so with the right language. Because when you have clear communication, just like in relationships, it's 90% of problems can be solved when you have clear communication.
Yeah.
Clavier.
Okay, I agree with what Will has shared out. I think the resource for PACs and families, I think it's a great something that we can share out individually at like with the PACs to their parent email list. And also at PAC meetings, like I think that they can, you know, have these meaningful conversations and how they, you know, as the PAC executive or you know, the parents that are at the school in the school community, how they can work together to provide the support and resources for families that you know, need it. Working with, of course, the administration at the schools as well. I think that mental health is such an important topic and affects everyone differently. It, like Will said, it's not one size, you know, fits all. You have to go through different things. Like if you have suffered trauma, then it's going to be something. If someone passes away in your family, or you know, you have been victimized, like there's so many different categories that you can be affected by. Or it could even be like, you know, the stress at school, like, you know, the anxiety, like you're starting a new school going into grade 8, or like you're a new family coming to a school community. There could, you know, and you're moving from a different country. There's just so vast a number of reasons that you could, you know, your mental health could be affected. I just personally say that in the North Van School District, we have mental health and well-being as one of our strategic goals. And, you know, that was well thought out with a lot of communication and, you know, working collaboratively with the community. So I think, you know, having those conversations where it like normalizing the discussions. And I think the more that we talk about mental health and share where people can go for help, support, and resources, the better we can be there for one another and make it a better community for everyone.
Clavier. Kendra.
So it's going out in our BCC Pack newsletter here later this month. I also plan to take it to principals in my district and any other ones that I talk to. Many parents who are struggling with things may not be connected with their pack. as much as they belong to their pack, many see the pack as a elite group of parents, where all parents are technically part of the pack. It's whether you choose to attend. So I feel like some of these parents could use this information that may not get it from the pack. So I think it's very important to bring the principals on board, make sure they have the information, put it down, put it to the counselors, so those counselors can send it home with those parents who also might be struggling, and have those use that document as well, not just the parents. I will, of course, get it out to my PACs and DPACs to send out, but also getting it to in the principal's hands for those student who may be at risk, that the principal knows about.
Can I just add one thing? I think I really agree with what Kendra said, that a lot of parents do not attend the PAC meeting, so they might not be able to take part in those discussions or conversations. I plan to also share it with our district principal and have it posted on our school district website. But you know, having it sent out by the principal through their newsletter, so that you know, each school community has the guide that can be shared out. And you know, some people, you know, they want the guide, but they don't know how to get it, or you know, how do they ask for help? That can also be one you know, barrier for some families even reaching out in the first place to ask for help. Thank you.
Great. Thank you so much, Will, Clovier, and Kendra, for taking that panel discussion. I also just want to transition to our Q&A. So if there's anyone who would like to ask any questions, please feel free to put it into the question and answer box. And I'd also like to invite Angela to join us for our Q&A as well. First question that we have in our Q&A, actually we've kind of touched on, is how will this resource be shared, promoted to families across the province? We do have the guide available on the Erase BC website, as well as the Kelty Mental Health Resource Library. But I believe this question is also speaking to how can this get into the hands of families at the school level. And I think Kendra and Clovier, you really spoke to some very actionable things. So it'll be shared out through district parent advisory councils. Kendra, you spoke to sharing it out with principals that you are in contact with. Any other tips for how to share the guide with other families and others in the school community?
I think I can speak to just a few additional steps. With the BC School Counselors Association, we check your website pretty regularly. And when there's a new resource from BC Children's Hospital, we're on that one, and we try to get that out to the school counselors around the province pretty quick, because we're always looking for new resources. So I anticipate that'll happen. But there's also, and I actually find this to be another reason to have hope, is in every school district in BC, there are tons of people working behind the scenes, and they're working very hard in the school district offices to make sure these sorts of resources are getting out there. So I wouldn't be surprised if you already have people, maybe they're even attending, who are working at getting these things out there. In my experience working in the school, the best way to get a resource in somebody's hands is to get it in their hands, because in your inbox it might not always end up getting used, but when you got it on paper, that's effective.
I think I might just add, if it's okay, that it's good to have like a wave of awareness and sharing out of the resource. But I think one thing I think about is, and I think this came up a couple of times, Clovier, maybe you mentioned that sometimes with regards to mental health, we may not know that we need these answers until we need these answers.
Yeah.
And so keeping it on the radar somehow across the school year, having it as a resource that educators or staff or principals or PAC members remember that it's there, if and to be able to offer it to someone who in that moment is struggling or has questions around mental health, that would be really helpful. So yeah, just thinking about not just the initial wave of sending it out, but also how do we keep this resource on the radar for when it's needed.
Yeah, I think passing, also sending it out to superintendents,
Mhm.
giving them, you know, the hard copy, or it would probably can't do that, but just sending like a specific message, even if like Crystal could send out like a message just to the superintendents. You know, this is a new resource. Can you please widely share it out? Again, speaking for my school district, in October, when it is mental health month, we usually hold a standing committee dedicated to mental health, and we talk about the different resources that are available to parents, students, and families, because the makeup of families is also different. It's not just mom and dad. It could be grandparent. It could be aunt, uncle. You know, vastly different. So we do host that public meeting. So, you know, that will give us another opportunity to share the guide in North Van. But I really think that, you know, having the principals, having a link there, but finding ways to bring this conversation up. Like, yes, okay, October it passes, but then what about the rest of the, you know, 8 months? Where's that discussion going? I agree with Angela that, you know, it shouldn't just be spoken about like when the guide is released, or it's the, you know, dedicated month that we're talking about mental health, but you know, mental health is every single day. And how do we keep those conversations going? And I think empowering families at each school would probably be the most effective, because you have, you know, your people at school, like, you know, who you can approach to get help, and you know, having those resources available so that you can go up to somebody and talk about it. Giving those trusted adults for students in schools, having the student leadership in the high schools. They share this resource out with, you know, they're at their schools, and having those discussions, maybe dedicating a meeting where they're going to talk about just mental health. So those are some other ways, but I do think that the conversation should be continuous. And you know, maybe the people that have worked on this guide, you know, send out little snippets, like maybe Kelty could send out, like, you know, some sort of resource that they want to highlight each month, and then others that are supporting this work can share it out and talk about it that way as well. And Kendra, you know, when the meetings are going on where you're meeting all the different parents and packs, you know, sharing it there, but, you know, asking them, like, you know, everybody has to take like a accountability and a role in how they want to share this resource, because it is valuable. And you know, you could possibly be saving somebody's life, and to the extreme. But yeah, I think, and we also can't put it all on school counselors, even though, you know, Will and everybody is doing a good job. But, you know, we need to have more of a collective approach for support.
Thank you so much, everyone, for responding to that question. Um, the last question is, have you as parents and caregivers used some of the conversation starter tips? How did that go?
I can't say I have. My kids are 18 and 23, so we're just beyond that. And then I help raise a 6-year-old, but they would be ones that I would have used in the past. Like they're very similar to the ones I would have used 5 years ago when I was dealing with this. But can't say that I used this time just because my kids are a little bit beyond that age at this point.
Yes, my answer is similar to Kendra. My kids are also on the 17 and 19, so it's a different conversation. But I do visit schools, and you know, if I see any child that comes up to me and, you know, wants to talk or support, then, you know, I would give those uh, conversation starters to the principal and the teachers of the students, so that they can reach out, and then in turn with their mom and dad or family.
Great. Thank you so much to our panelists and Angela for being here today and answering some of these questions that we've received. We are coming close to the end of our webinar this afternoon, so I will share the wrap up of our presentation today. Again, thank you so much to our panelists and guests for your time and for being part of this very rich discussion. If you have not yet seen the guide or looking for it or want to look at it later, you can access it. So the link is in the chat. It's also on the Erase website under the mental health and substance use section, or you can also find it on Kelty under the resource library. We did receive a question about will paper copies be sent out to schools? That might be a discussion to have with your district or your school, and however your parent advisory council might want to chunk up that information or have that available to families within your own school community. So please read the resource and share it with others that you think would benefit from it or just be able to take in this valuable information. For parents, caregivers, and guardians joining us today, if you have not heard about BC Children's Kelty Mental Health Resource Center before, we do help families across the province by helping with understanding and navigating the mental health system. They offer peer support from family peer support workers, and we can also connect families to resources and tools, especially through our website. You can find us on our keltymentalhealth.ca website, or you can also use some of the contact information here as well. Lastly, please take a moment to share your feedback with us. You can follow the link provided in the chat or use the QR code on the screen. We really benefit from hearing your feedback to help us improve our webinar series in any way. And finally, please connect if you have any questions. We're always happy to take any questions, and we really appreciate your time joining us this afternoon. So thank you so much for joining us and listening to us share more about the resource that we've developed in partnership with the Ministry of Education and Childcare. And I hope that everyone has a great day.